Welcome to a one-on-one conversation with Linnea Duff and Farago. Linnea is a writer, artist, and mother of three. She's also a cancer patient and advocate. In April 2005, she was diagnosed with non-small cell lung cancer. Only 45 years old and a never smoker, she was determined to beat the odds. So almost 9 years later, she's doing exactly that. Intensely interested in the challenges posed by living with advanced cancer, Linnea is focused on the physical, emotional, and social impacts of terminal cancer, issues she explores both in her art and her writing. Active as an advocate for other patients, Linnea was recognized in 2012 by the 100 at Mass General Hospital. And she also serves on the Patient Family Advisory Council there. She chronicles her journey with lung cancer through her blog and has participated in countless media opportunities. Anna Farago grew up in Newton, so she's a local girl. She attended Haverford College, which is outside of Philadelphia. She came back to Boston and did her MD PhD at Harvard and completed her PhD work with Susan DeMecki on brain development, studying brain development, I guess. She became interested in oncology during her third and fourth year of medical school, and after she completed her PhD, decided to become an oncologist. She did her residency at Brigham and Women's Hospital, and then started as a fellow in the Dana-Farber Partners Hematology Oncology Fellowship Program. She's now in the final year of her fellowship and does her research in the JAX lab here in the building on small cell lung cancer. She is performing preclinical therapeutic studies using a mouse model and is also maintaining an active connection, clinical connection with the Thoracic Oncology Group at MGH. So Anna and Linnea, take it away.
Thank you, Anna. If you guys can't hear us at any time, just let us know. Thank you, Linnea, for being here today and sharing your story with us. So Anna gave a nice introduction in general, but I wonder if you want to, in your own words, just introduce you as a person to the group and before we kind of delve into the story of your cancer and what you've been through with that.
Sure. I guess I can start with I'm now 54 years old, not 45, and I'm one of those people who does not see getting old as a problem. In fact, it's the objective. I really hope I get to be an old lady. My youngest child was just 7 when I was diagnosed, and he's 16 now. My older two are 29 and 28, and I consider it an extreme privilege to have been able to live with what is considered a terminal illness for so long. And of course, living with a terminal illness for a long time can be problematic as well, but I accept all the problems. I start every single morning by saying, I'm alive, I'm alive, I'm alive. And I hope to be for a good deal longer.
Why don't you tell us about what happened around the time when you got your diagnosis to give us kind of a starting point for your story?
Sure. Well, as I mentioned before, I was 45, in generally good health, but for a couple of years prior, I had frankly had all the symptoms of lung cancer. Shortness of breath, chronic cough, I even coughed up blood a couple of times. Interestingly, I had some noticeable weakness in my upper arms, which later on I've come to believe was probably a paraneoplastic syndrome. And I was worked up for quite a few things. I had a neurologist suggest that perhaps I was a hypochondriac, but ultimately I was diagnosed with asthma, adult onset asthma, cough variant, and treated with asthma medication for a couple of years. But then I got a case of pneumonia that just wouldn't clear up, and finally had a CAT scan, which showed a very large mass in my left lung. And on that particular day, my husband was with me, and we had a meeting with the GP, and when she was talking about the differential diagnosis, it was a recalcitrant pneumonia, fungus, or a neoplasm, and at that point in my life, I didn't even know what a neoplasm was.
So that's the word that she used?
Yep, neoplasm.
And when did it occur to you that she might be talking about cancer? I mean, I imagine in the course of that conversation, but how did that
Well, my
set in
husband's
for
face
you?
fell. He has a PhD in chemistry, and he knew exactly what she was talking about. But it wasn't until she left the room, and I said, "What's a neoplasm?" And he told me that I realized that suddenly the stakes had changed. And I actually went directly from there to a local hospital where I was admitted, both for IV antibiotics and to await a lung biopsy. And it was in the next few days that I learned a few things about lung cancer. And, the most startling thing, of course, was that it had a 15% 5-year survival rate. But up until the moment that I actually heard the words, "you have cancer," I was convinced that I didn't. In fact, even the surgeon radiologist who performed the biopsy, he just said to me, "I think this is a fungus. There's no way. 45 years old, never smoking, you have lung cancer."
Yeah. How did that set in for you as somebody who is a never smoker? I think there's still the common belief that only people who smoke can get lung cancer.
Yeah. Well, my view toward that has really evolved. The truth is, if I can be frank, at first I was just pissed. I was so mad. And part of it is because I had never liked smoking. I had worked in a lot of environments where I was exposed to secondhand smoke. I'd waitressed for years, back before they had any regulations. One of my parents was a smoker. And I remember also thinking, why couldn't I have gotten breast cancer, or at least I'd have a color and a sisterhood and, frankly, better odds of surviving. If I can handle a challenge, but why this challenge, And I remember saying to my husband, I wouldn't have been more surprised if I'd gotten prostate cancer, I mean, I just didn't know it was even possible.
Yeah. So you got your diagnosis while you were still in the hospital, and what happened next?
Well, the surgeon that I was assigned had... Okay, can I be frank again?
Please.
He was an asshole.
Tell us why, too, because I think that this is we want to hear why you had these feelings along the way. This is great.
It was just so obvious. I mean, it was immediate. Here we are, terrified, having heard this news that was completely unexpected. And, I often say to people that when my doctor herself said to me, "I'm sorry, you have lung cancer," it really was like being in an airplane. You always imagine, what's it like to be in a plane when the pilot comes on and says, "We're going down." That's what it felt like. So, just sheer panic. And my husband had some questions, and he called the surgeon that night, and the surgeon yelled at him. And we just decided, nope, this is not the guy whose future I'm going to put, my future into his hands. And fortunately, I have a very good friend whose husband did his residency at Harvard, and we called him and said, "Who should we go to?" And he directed us to Doug Mathieson at MGH. And I can tell you that the reason I'm still alive is because I went to Massachusetts General Hospital. It really changed everything.
So you underwent a surgery at that time, and just for the group, this is in terms of the stage of the disease, you were stage 2 or stage 1 at that time? 1B. Okay, so a large lesion, but not involving any lymph nodes that they were aware of at that time, and potentially curable.
Yeah.
Did they describe it to you as potentially curable, or what was your sense of your potential outcomes?
Yeah, it was potentially curable, and of course, from the time of diagnosis on, you have all these hurdles you want to jump, and because you have to do a significant amount of testing before you can even have the surgery. You have to have a PET scan, you have to have a brain scan, a bone scan, and so it's, each one of those I got a clear on. So this meant surgery was possible, and we went and spoke to the surgeon at MGH, who inspired great confidence in both of us. And he said, "Yes, I think I can do this." But he also explained that prior to actually removing my lung, he would go in through my neck and remove a bunch of lymph nodes. I have a nice little scar here. And so the next hurdle to jump through was he explained that should any of those lymph nodes contain cancer, he would not remove the lobe of my lung. So when I awakened from surgery, my very first question was it a long surgery? And it had been, so that was the good news.
Okay, so they went ahead and did the whole lobectomy.
Yep.
As planned.
So I got through that. It was pretty tough. I kind of emerged a frail old woman afterwards, but was very grateful that I had that done. And then I had a stroke of really good luck. Tom Lynch was assigned as my oncologist, and the reason he was is because given my age and my non-smoking history, he figured I probably had an EGFR mutation, and that was something he was very interested in at the time. And I had no idea that because of that I was getting a phenomenal oncologist. And he, right away, because of the size of my tumor, argued that adjuvant chemo would be the way to go. And I argued strongly against it. I had a terror of chemo, I think, that, from childhood, just hearing about it.
What was your imagination of what it was, and then what was it actually like going through it?
That I would throw up all the time. And actually, I have spoken to chemotherapy nurses who say that, indeed, before the antiemetics, that was what it was like. Basically, a person was admitted to the hospital, and they would give them a lot of Ativan, kind of knock them out, get them through it. Those have made a big difference. It's still very, very hard, And there were actually communications going back and forth with Tom and I about percentages. And, I think he upped my 5-year survival rate to 87%. That's what I remember if I were to get adjuvant chemo.
So that number made a big difference for you, huh?
Yeah, I think for most patients, when you're first diagnosed, for better or worse, you really focus on the numbers. They mean so much to you, whether it's stage, percentage. And, as time has gone on, and first of all, I've defied the odds. I'm way out there on the end of that curve. I really don't pay much attention to the numbers anymore. Besides, when you've been a stage 4 this long, it gets old, But I think in the beginning, you don't really understand that a lot of that exists basically as a guideline for the therapy, right? I mean, it's more indicative of that than it actually is your chances of surviving.
Right. We use it as a guide, certainly. But I think that it is something very solid that people can hold on to when you're in a time where so much is up in the air.
Right. For better or worse, I think.
Yeah.
Because I think there's a lot of misunderstanding that goes with it.
Of what those numbers really mean.
Yeah. Yeah.
I think you're right. So you underwent chemo. Tom continued to be your doctor. And after your chemotherapy, what were you told, and what was the follow-up like in the next several years?
Well, of course, I had lots of questions about that going right out of the gate. And the plan was, I'd have a clean scan post-chemo, and, maybe then I think it was come back in 3 months the first time, but then 6, and then 6, and then a year. Well, my very first scan post-chemotherapy, there was already a nodule in the lung. So I had to adjust my expectations rather quickly, and Tom did not say, this is cancer, but he also didn't say, okay, no evidence of disease. I actually never had that designation. And my feeling is he probably understood right then that there was a great likelihood that that's what this was. But, without a biopsy, it couldn't be determined for sure. And so then we began a period of what I call watch and wait, where I continued to go in every 3 months and have a scan. And frankly, every scan, there was more of the stuff that Tom called schmutz. But he still said, could be TB, could be scarring, could represent a lot of things. So I just kind of tried to run with that. And I think the one thing I was working on psychologically at this point in time, because this is a hard time, because your friends look at you, they know you've gone through chemotherapy and surgery, your hair's back, you look like you again, or your hair is starting to come back, and they think you're fine. They think everything's okay. Whereas in my mind, I know that it may well not be okay. And of course, it's something I think about all the time. So almost like hearing fairy tales or bedtime stories, I'd ask Tom again and again, tell me about those people who are outliers. That was the magic word, you know. I want to hear about somebody who's lived 6 years or 7 years or 8, you know, and that's kind of the star I pinned my hope to, you know, because maybe I wasn't going to be cured, but maybe I could live a long time.
And as you guys were watching this schmutz over time, do you think that you both kind of knew what was going on and didn't want to look into it further, or is it only in retrospect that you have a clearer sense of what was actually happening?
Yeah, in retrospect. I think he knew what was going on. I think I didn't. And one thing I should add is that my histology of my cancer, it used to be called mucinous BAC. Now it's, invasive mucinous carcinoma or something. It's got a new name. But it's known to have a poor prognosis and not respond very well to therapy. And this was something that Tom was obviously aware of, that there weren't a lot of good therapeutic choices. But I wasn't. And I don't think I ever said this, but way back when I did not test positive for the EGFR mutation. You know, I did not have that. So I think that's part of the watch and wait approach is, you know, let's preserve your quality of life. There's maybe not a lot we can do anyway. And there was a period of time, about 2 years after that initial post-chemo scan, where I said to Tom, so approximately how many of these little schmutzes or whatever do I have in my lungs? And he says, approximately 33. And at that point in time, I just got this picture of, oh my goodness, if this is cancer, then this is serious. And actually within a few months, I began to be symptomatic again.
So then we know from the introduction that there was a turning point that came soon thereafter. Why don't you walk us through what happened with that?
It was about June of 2008, and my daughter was getting married in a few weeks. I had gotten significantly sicker. I'd had another biopsy. It had been confirmed that my cancer had spread and that I was now stage 4. And again, I was not really educating myself at this point. I was kind of along for the ride. So I was very surprised. I thought you'd go 1, 2, 3, 4. I didn't know you could go 1 to 4. It's like, wait a minute, how'd this happen? And for the first time, when I asked Tom about how do things look, for the first time ever, he said it might be time to get your affairs in order. So I knew that things were pretty grim. And I began to see a psychiatrist to basically help me learn how to die. And our youngest, who at that point, I guess he was 11, he also started seeing a counselor because he, strong denial, couldn't even talk about this possibility. And we went ahead and put me on an EGFR inhibitor, just because back then you were kind of trying this. And my daughter was getting married. I started on it, I think 4 or 5 days before, and Tom said, don't worry, you won't get a rash. Well, of course, break out in a horrible, horrible rash right before the wedding, head to toe. Ugly word, but true, pustules. And I just had to tell myself it wasn't about me, it was about the bride. You know, I could still do this. But it was also very bittersweet, you know, having my daughter get married and, you know, being so happy, but thinking, God, I'm never going to see any of my grandkids. You know, this sucks. So I was on Tarceva for about 2 months, got all of the side effects, none of the benefit. What they say about the worse the rash is, the better it's working, not necessarily true.
Not if you don't have an EGFR mutation, perhaps.
Right, for sure. And I mean, without trying to exaggerate too much, I had to take pain medicine because my hair follicles hurt so much. You know, it's like every time something touched me. But I went in for a scan review after being on it 2 months, and Tom confirmed that no, it was not working. And he said, so, you know, way I see it, you've got 4 choices now. You can stay on the Tarceva, you can return to traditional chemotherapy, you can do nothing, or you can try this clinical trial, because as it turns out, we checked your recent biopsy for genetic mutations, and you are positive for an ALK mutation, and there's phase 1 clinical trial opening here at the hospital, and actually open. But at that point, there were so few people with the ALK mutation identified. There had only been one other person on trial there, and that gentleman had died a couple weeks after starting trial. So this is really all I knew about it.
And when it was presented to you, did it sound like this is really the right choice for you, this is going to be a breakthrough drug, you're the right patient for the right drug? Or did it sound like, hey, we don't have a lot of other options for you, this is something you could try if you're interested?
B. I wasn't educated enough at that point, and, and hadn't even sought to be, frankly, and didn't have that kind of patient-doctor relationship with that oncologist. And no, it was more like, okay, I have a bear chasing me, I'm coming to the edge of a cliff, there's a branch hanging right there, I'm going to grab it. And my quick perception was, all right, the first 3 choices he's offered me are all dead ends. We all know what means do nothing means.
Right.
But this one offers a sliver of hope. And I can personally say the only place I don't want to be as a cancer patient, although when it happens I will accept it, is no hope. Even a little hope is a lot to go on.
Yeah. So you went with the trial.
I went with the trial. And, the question you ask, of course, talking to people now, talking to my current oncologist, Alice Shaw, they all were excited in the lab. They knew what this meant, that I was entering a trial with an enriched population. And they had seen what happened to ALK cancer cells in the lab.
Yeah.
So they thought I might have a pretty good response. But I had been on the drug maybe a week, and I emailed Tom and I said, you're never going to believe this, but I feel better. Mm-hmm. And any other treatment I'd had prior to this made me feel worse, and maybe ultimately better. But my cough was starting to go away. I had more energy. This was not what I expected. I expected that, if anything, my life might be extended for a couple of months, but in the meantime, I might get really sick. Mm-hmm. So he just said, that's great. I'll let the team know.
So crizotinib, so everybody knows, is a pill that you take every day. And tell us about the side effects of that compared to the erlotinib, the EGFR inhibitor that you have been on.
Or chemotherapy. World of difference. The cohort of the trial I was in actually was kind of funny. It was called the eating cohort. And the very first day I was fed a very fatty breakfast. And the hardest part was drinking a full glass of milk, which I haven't done in years, and eggs, toast. I had to eat all of it. So I ate that, and then they gave me the pills, and got some pretty vicious diarrhea within a couple of hours, And so I thought, okay, well, there's going to be some side effects. Yeah. But I can honestly say I was so scared. Here I am in clinical trial, I could die. But nothing else scary happened, And no, the side effects, there were a few at first that got better. There was an interesting side effect that, being one of the first patients, I was one of the first to report, which was a visual disturbance, where particularly in low light, you saw kind of like these light trails, a little bit of edema sometimes in your ankles, occasional day of feeling nauseous, but I was able to return to normal day activities. I really felt almost like a completely normal person.
So by the time it was time for your first scan, what were you expecting going into that?
It was the first time ever I had not had scan anxiety, because you got to realize I'd had 3 straight years of worse scans each time. This is just my reality. And I didn't think it'd be a great scan, but I was pretty sure it was going to be a better scan. So I went in there, and Tom walks in the room, and I've told this story so many times I could probably tell it with all the words backwards, but he's grinning ear to ear. He walks in and he says, "This is the best news I've given anybody in so long." And he says, "This is flippin' amazing." Mm-hmm. And he pulls up my scans and he puts them side by side, and the before, what's left of my left lung in particular, is it's white, it's like a blizzard. It's just filled with cancer. And the after, you can't see any cancer, and I just burst into tears. It was like, oh my God. I mean, it was an unreal feeling. Yeah. It was like I was in a fairy tale.
It's amazing.
Yeah, it was.
So, so you stayed on the crizotinib.
Mm-hmm.
And just walk us through the next sort of several years with that.
Well, it was frankly an exciting time. And I mean, I remember Tom even that day saying something like, this is going to go down in history, I'm paraphrasing, but, he saw this for the momentous moment that it was. And for me, I'm just thinking personal significance, I'm alive. I'm going to be here for Christmas, Yeah. And it was a really exciting time over the next few months as more patients enrolled. I actually had the opportunity, I was number 4 in the world of non-small cell lung cancer to get crizotinib. I became very close to number 3 and number 4. I mean, did I say 4? Number 2 and number 3. I'm 4. So I got to know some of the other patients really well, and that was really special too. I think it was spring of that year that NBC News did a story on my situation. Yeah. And at that point, I think a lot more calls came into MGH2 from around the world. Mm-hmm. In fact, I have a very good friend who's Japanese, whose sister saw the NBC News report and got her on crizotinib, and she's still on it.
Wow. Got her to MGH to go on that.
Yeah.
It's amazing. And you had a change of doctors at some point along the way too, and tell us about that.
And I'm going to quickly mention 2 things I left out. One is that Tom actually suggested I start writing a blog. His wife is an author, and I guess she writes a sports blog. And I'm not even sure I knew what a blog was at that time, but it sounded like fun. So I did start the blog that summer. In the meantime, Tom had gone to Yale. When I first heard he was leaving, first of all, I read it in the newspaper, and I was very upset with him. I sent him an email and said, this is like breaking up by email. You really should have told me. And at this point, I figured this was the person who kept me alive, and I was terribly upset and said, I'm just going to follow you to New Haven. There's just nothing else is acceptable. But he said to me, you're going to love your new oncologist. I guarantee it. She's great. So I'm an open-minded person, and the first time I met her, it truly was love at first word. I was in the bed, I was in for the clinical trial doing the PKs, and she spent, I think, an hour with me, and I learned more about my cancer that day than I had known in the previous 4 years. I mean, she was so indulgent. So that was a really good thing. And then I just want to add a little trivia.
I'll just say that your oncologist is Alice Shaw, who is a close friend of the Koch Institute here. So
that September, I was on a field trip for my son at school, and we climbed Mount Cardigan, and I was pretty excited that I could do this. Well, on the way down, I was coming down, and a kindergartner checked me, and I fell, and I got a spiral fracture of my left ankle, and ended up having to come down by search and rescue. And everything about it, in one of those little things they carry you. Fire truck in the parking lot, ambulance, my son just... my mom. And, of course, they're on the phone to Alice. Can she even have pain medication? Alice is on the phone to Pfizer. Can she even have pain medication? The whole thing was pretty dramatic. But the next time I saw Tom, I spoke at Shine a Light on Lung Cancer a couple months later, and I had this big old cast on my leg, and he says, what'd you do? And I said, I broke my ankle climbing a mountain. And he says, fantastic. In fact, I just spoke to somebody a couple weeks ago who had gone to see him at Yale, and he had repeated this story. And the way he tells it now, I was climbing Mount Washington.
You're moving up. Next, you'll be on Mount Everest. There you go. That's great.
Yeah.
So it sounds like things really, really took a big turn for the better with crizotinib. And I know since we've spoken before that lasted several years, but it hasn't lasted forever. So
No.
what happened?
I actually began to show resistance after 1 year. But it was pretty slow resistance, and we were able to keep me on the drug for almost 3 years. In fact, I came off of it just a month before crizotinib got FDA approval and became Xalkori, and I got to go to their launch, which was pretty exciting to be on the stage with a lot of other patients and, meet a lot of the pharmaceutical community.
Yeah.
At that point, I started on a second generation ALK inhibitor, LDK378. And it was interesting because I had an acquired secondary mutation that I had picked up and that had been shown in a biopsy after coming off of crizotinib that looked like it was going to respond very, very well to LDK in the lab. I did not respond as quickly as it had been predicted, and I had a lot of GI side effects with that one, so it was a little bit harder for me.
Okay.
Ultimately, I did end up achieving almost a 70% response, which is what I had with crizotinib. Even though it looked better, it was classified as 70%.
Right.
And that I was able to stay on for 15 months. Again, a little more problematic all throughout. I had liver toxicity twice while I was on that and had to come off drug. But both times they let me go on. I just had to go on at a ultimately lower dose. So I stayed on that until just about a year ago.
Okay. And then just bring us up to date since then.
Well, at that point, the discussion was, all right, we got to get you through until they have another ALK inhibitor. And I had another biopsy at that point, which showed that I had another secondary acquired mutation. The first time my acquired mutation had the good luck of being one that was very responsive to all the current ALK inhibitors. The one I have now is the least responsive, the most resistant of all the secondary mutations. So there were certain drugs out there that are in trial right now that Alice felt were not even a possibility just because of what we could see in the lab. So our kind of plan was, let's see if we can get you through another year and hopefully there'll be something else out there. So kind of kicking and fighting, I went back to traditional chemo, carboplatin and pemetrexed. And I had 6 rounds of the duo and then 6 rounds of just the pemetrexed. Unfortunately, because I've already had cisplatin, the carboplatin, my first round, I had so many side effects. I mean, they can have a real, I guess, even after years, cumulative effect. And my first time out was so bad that they had allergy testing done to see if I was, what do you call it? Just hypersensitive? And they didn't think that was the case, but they ended up administering it at a lower dose and much more slowly and with the crash cart there the next time just to make sure.
Right.
So I got through it. I don't think it was a super pleasant experience, but obviously I'm still here. My what can I say? My scans at that point when I entered the trial looked pretty bad again. The problem with the kind of cancer I have is it's very hard to differentiate on a scan between inflammation and cancer because it all has that ground glass appearance. And I think that probably the LDK gave me pneumonitis as a side effect because I began to feel better as soon as I came off the LDK before I even started the carboplatin. But whatever, I got through another year and right now I'm on break. I've been on break from treatment for a couple of months, a self-requested break. And I'm really hoping to get on trial with the new Pfizer ALK inhibitor.
So we've gone then from hearing the word neoplasm and not even really knowing what that means to now you're talking about the details of your ALK mutation and how that responds to different drugs and which different drugs would be better or worse options for you. And to me, that's a remarkable transformation over that time in terms of your just engagement and knowledge of the science behind all of this. So I wonder if we can use that as a starting point for you to talk to us about how you've been involved with the research community and how you, from your perspective, see the interplay between the research community and the clinic
Sure. I actually just flew in yesterday. I was in Baltimore last week as a peer reviewer for the Department of Defense congressionally directed medical research programs in lung cancer. And so I and two other women, we were all called consumer reviewers, all lung cancer patients, sat on a panel with 14 scientists and reviewed proposals for lung cancer research. So yeah, it's a big jump from somebody who didn't know neoplasm, but it's been great. And my own perspective, and not all patients feel this way, but to me, what is most frightening is what I don't understand, and being in that room almost 9 years ago and somebody coming in and telling me I had cancer, not understanding anything about it, except that I had heard it could kill you and that it might be really unpleasant, I was terrified. And I feel that being more information-based helps a patient. And there are some patients who would have to be sold on this and some who might never come to the table. But, for instance, Duff, I now refer to as my familiar. He's not an invited guest, but been at my table long enough now that I recognize death and it doesn't scare me, and I just think that's better. And I actually feel the same way about all of the mechanisms underlying it. In fact, there are times when Alice and I are talking about what's going on with me, and I'd say, this would be really interesting if it wasn't happening to me. I can kind of look at it that way. Yeah. And I don't know if that really answered your question, but maybe it started to.
It gets at it. I think I ask it in part to kind of try to engage this community, which is very much in the science of the world of cancer, and start to think about how what's done in the laboratory and what's done by researchers really can directly come to make a big difference in the life of an individual person.
Yeah.
And that you are a really remarkable example of that in live time, and frankly continue to be an example of that as you're talking about what's the next upcoming trial that you're hoping to get on, knowing what you now do know about your disease.
Well, what I can tell you in the vernacular is that all patients think cancer researchers are rock stars, absolute rock stars. So, we appreciate so much what you do and know how hard it is, and are so grateful that you are doing it. And please keep doing it.
I wonder if you could also just tell us a little bit more about, you've had many doctors at this point, and you've made reference to some being much better than others, but specifically, what are the things that you have really appreciated in a patient-doctor relationship, and what are things that you would say did not work well for you?
Well, obviously you want a doctor who's good, and, certainly Tom Lynch, great doctor, saved my life. You want a doctor who cares about you and who's kind, and he was both of those things as well. And, I would try to pin him down sometimes more on that survival thing until I got to the end where he said, might be good to get your affairs in order. And he would always say to me, we are doing everything for you that we can. He couldn't be pinned down. But it was a really great answer because it never took away my hope, but also didn't give me false hope. So I think he was an excellent doctor, but it's just when Alice became my doctor, for me, she was a better fit, because here was my inner geek who always wanted to ask all these questions, and finally I had someone who was willing to answer them. And it empowered me in a way that honestly changed my whole life. It made me more confident and stronger in every way. And maybe part of what Alice does, and part of this is because I've been a participant in a clinical trial and not just a patient. And when you're a participant, one thing I noticed is that instead of going in and apologizing about your little symptoms, they want to know everything. Like when I had the thing going on with my eyes, that was important. They needed to know that. Yeah. But Alice has really made me feel like a member of a team. And that's pretty huge, you know, because it's not like the medicine and the science is just being done to me. I'm an active participant, and not even so much just that I'm willing to put those pills in my mouth, but because she really values my insight and my opinion too. And I think one thing I could also add is as part of my advocacy and even just part of my personal survival, I'm really involved with some online support groups. In fact, a member of this audience works for Inspire, and they have a big online lung cancer group, and that has been huge for me too. I do a lot of that. I've made a lot of friends that way, and patients now exchange so much information online. You know, and of course, not all of it is going to be good, but you'd be surprised at the caliber of a lot of it. And in fact, John, you may be able to answer this, but some years ago, a woman who was ALK positive started a thread on Inspire for ALK positive patients, got closed down twice because there were too many responses, and then she convinced Inspire to leave it open. And how many responses does it have now? The last time I looked, it was at least 3,500. And maybe it's more than that. But these are people who are ALK positive, and Ross1 has joined on there now too. And they're talking back and forth to each other, giving information about clinical trials and, you know, this and that. And I think it's fabulous.
Remarkable. Maybe we can actually, we have 10 or 15 minutes left, but we definitely wanted to leave time to open up to the group to see if there are questions from the group. So,
Linnea, let me first thank you for being here. Your story is inspirational, and it's really, I think, wonderful for our trainees to hear the benefits of research from a patient who's benefiting from this type of work. So you, it seems to me from your description, have transitioned from sort of a victim of the disease to someone who's much more actively taking charge of their treatment and their understanding. So I'm just curious how your perception of your disease has changed over time. Obviously, at the beginning, you were quite ignorant, and now you talk about it in very sophisticated terms, in the same ways that we think about it. Your disease is not this thing that's overwhelming you, but it's a series of changes in genes and cellular processes. So do you think about your disease differently now?
Certainly. That's a really good question and observation. And in fact, I would say that it's part of that is practical, part of it is almost spiritual, although I'm an atheist, but I'm a superstitious atheist, which I think so that makes me suspect right out of the gate. But one of the things that I read in the beginning to try to help me were books on Buddhism, because I was so angry. And I also have a really short attention span, which is a very good thing, because I got tired of myself being so angry really fast. But part of how I stopped being angry was to stop taking my cancer personally, which is a challenge because it's a disease that arises from your own cells, you know, and you do feel at first like your body has turned on you big time and let you down. But yeah, I had to achieve some separation there. And actually, I can say the same thing even about my anger about smoking, where once you become a lung cancer advocate, you realize what a contentious issue smoking is. And when you tell people you have lung cancer, almost always they say, "Did you smoke?" Well, if I did smoke and somebody asked me that, that would make me feel pretty bad, you know? And so I'm not angry about that anymore either. I'm still mad at big tobacco. And I'm a little mad at our government for taking money from big tobacco taxes. But no, I don't take that personally anymore either. So I think not taking things personally is a big part of it.
So I was also sort of struck by the different ways you described your physicians, some of them more positively than others. And I'm wondering, as you talk to other patients out there, sort of overall, how do they feel about the amount of information they're getting from their physicians, interpretation of that information, and whether it really is enough to help them understand the decisions they need to make about their treatment?
I think it's very individual. I will say that most of the patients I know who have lived a really long time, like I have, tend to be people who have decided to be information-based. But not always. Certainly there are some people who are diagnosed at stage 4, but then never have evidence of disease again, so they can leave cancer behind them. But if you're going to be actively in the game this long, then I think you're better off knowing. And again, it depends on your doctor. Not all doctors are Alice Shaw. But there are also patients who really don't want to know. I have friends who don't even look at their scans. So that must be difficult for doctors. And one of the patients I'm thinking of is a patient of Dr. Shaw. So same doctor, different patients. I'm sure she handles that patient entirely differently than she handles me. I do think again the internet has helped. Even though I know in the beginning there was probably a lot of misinformation, I like to think that most of us can go into the office now with more confidence that we're asking a question that comes from a place of not just total ignorance.
Hi, I had a similar question, kind of based on how you defined a good physician. And when you first entered your treatment, how did you kind of go about gathering that information? I know you'd mentioned that a friend had recommended a physician, but for other people that don't possibly have that type of circumstance, how would you go about recommending other patients to find a physician that's willing to go the extra yard? I used to work in neurosurgery research previously, and based on the physician that you have, the potential for their own guidelines for that specific disease can be very different, even within a similar department, and just based on that physician's experience with that disease. And the other question relating to that is, during your treatment, did you ever find that the physician, that you were questioning your prognosis and your progression of the disease as you could seek better treatment elsewhere at all? That the physician, were you not sure of if the treatment was working properly, or if it was that the physician himself or herself wasn't maybe outlining the best care for you individually? And how did you kind of deal with that and make sense of that as a patient?
Right. Life's not fair, and I kind of hate the fact that not everybody has access to the same level of care that I have, which actually is part of the reason I felt that starting a blog was a good idea, because I could share some of the information and such that I have access to. And the beautiful thing about the internet is I really do get readers from all over the world. And the same with Inspire, the online support group, all over the world readers. When I was first diagnosed, I went to the library to get information. And looking for books on lung cancer, and I think I was allowed to check out 4 at a time. I'm sure they thought I was hypochondriac as well. But, very discouraging information too. Now, I do think that the internet is a good source. However, it's best to have somebody who's going to be able to go through it in a way and, separate the bad from the good. I also think that if it's within your means to do so, whether financially or just geographic limitation, get yourself to a cancer center, where there are specialists, because now it's changing, but, a year ago, there were still lots of people being diagnosed with non-small cell lung cancer, adenocarcinoma, who were not being tested for genetic mutations, and that's a game changer. And so we patients were trying to get that information out to each other. But if possible, being with a specialist, and I've had no complaints about mine. At one point, I really wanted a biopsy to get in a trial, and my tissue's hard to biopsy because of the histology. And Alice was hesitating, so I did mention I might go to Sloan Kettering. Just kind of threw it out there, and she was able to get me a biopsy.
I wonder if you could actually talk a little bit more also about the role of the internet, not just for you, but for other people who you've met through your blog and through your advocacy work, because I sometimes worry as a physician when people get a new diagnosis. The internet can be wonderful, but can be really horrifying too. And how do you guide people when you meet them or when you encounter them somewhat when they're already in their course of disease? How do you help guide them through what is helpful about using the internet and what can be very harmful about it?
Well, you can't believe everything you read. I tell people to not pay too much attention to those numbers. Mm-hmm. I feel that one of the most empowering things I say to people is just think of yourself as exceptional. Every single one of those waterfall plots that you see, there are exceptions, and certainly there are both ends, but look at that end, and just visualize yourself out there. And who knows, somebody's got to do that. Mm-hmm. This will be you. But I also think that getting support from other patients can be huge. Mm-hmm. And, sometimes there are limitations to an on-site support group. In my case, I did not want to go to a support group at MGH at first because I'd look around that waiting room and I just thought everybody was old and they'd all smoked, and I was not going to go to a support mm-hmm. group with them because I was going to be so grumpy. Yeah. And once I joined an online support group, and I really didn't do any of this until I had progressed to stage 4. But at that point in time, I realized I needed it. Yeah. All of a sudden, I was meeting all these people who were young as I was, and often younger. Mm-hmm. And one thing I do that I think helps me now is I make myself accessible to these people too. I mean, there are people who cold call me. I have a couple brothers from Israel who Skype me every once in a while. I don't even know how they found me. Yeah. But, we talk about my treatment, their father's treatment, and I have this policy that if anybody takes it upon themselves to contact me, I'm available, because I just think that that's one thing I can do to give back, and that I admire them for reaching out in the first place.
That's remarkable.
Yeah. First off, thank you so much for letting us know in such an inspirational way about yourself and your disease. And I guess when you're diagnosed, this is not only your disease, but it becomes your family and your loved one's disease as well. And I wonder, as a patient, what do you expect from those people when they know what's going on? And also as a patient, what do you expect to provide to them so that they can kind of have their own treatment and cope with it?
Right. That's a very difficult question to answer. And I'll be frank, I'm actually getting divorced right now, which is crazy at stage 4. But I was telling someone the other day I had aged out of my marriage. When I was first diagnosed, we were already having some problems, but the diagnosis kind of made us all, come together again. And I've lived long enough now. It's just like, well, I got to have another plan here. And I think in our case, one problem was I did pour myself into my diagnosis. And if anything, I think my husband sometimes felt our lives became too cancer-centric. So it can be hard. And I'm not sure that I have done everything the right way. It's difficult. As far as my youngest child, who was the one who was certainly the most impacted by the diagnosis as far as my children, Camp Kesem, which has a chapter here at MIT. It's a free camp for children who have a parent who's had cancer. That's been a life changer. He's gone to that for 3 summers in a row now. And when he came home the first summer, it was the first time he could ever talk about my cancer realistically. And so, I don't know, some of what we've been able to do, I think we've done badly. Some of it's been really good luck, like finding Camp Kesem. But I guess it's just a very individual process.
I'll take one more question. Yeah.
I wanted to ask you a question specifically about living in fear of developing brain mets, or maybe another way to put it, in your case, is generally fear of anticipating some development in your cancer for which there's not a foreseeable treatment. Okay, but before I ask you, get you to respond to the question, I want you to know that, and let the audience know, I am also ALK positive adenocarcinoma. And so I have had the benefit throughout my disease course of following what happened to you, and I know that, so what is sort of in my future, and so I've been on crizotinib now for about 18 months. And one of the fears I have is developing brain mets.
Yeah, thank you. Because of the histology of my cancer, it's unlikely that I will get brain mets, or bone mets, or liver mets, which, you know, obviously has its own advantages. What my cancer tends to do is just fill up my lungs. And I had a very good friend who passed away almost a year ago now. In fact, the New York Times magazine did a story just about a month ago about her. Read that story?
If you search New York Times lung cancer, Alice Shaw's featured in that too. So if you put in those terms, I bet that will.
And her name was Sarah Broom. She was a poet from New Zealand. And Sarah did get extensive mets everywhere. And at one point had 50 brain mets, you know, and lived that way actually for quite a long time. But Sarah and I spoke on the phone very frequently. We were really close. And at one point she said to me, "So when you die, you're going to drown. That must be really hard knowing that." And it was actually really important for me to have somebody who was facing all these other things that they were afraid of to acknowledge what I was afraid of. And I want so badly, sorry, this part's hard, to die with dignity, you know, and strength for my kids' sake. I mean, you can't control what has happened to you. You like to believe you have some control over how you will respond to it. What scares the hell out of me is what the body does when it can't breathe. You know, I mean, whether I don't want to panic or not, my body may panic. So that's my big fear. And I know that's a little different than what you're fearing with the brain mets, but I hope that helps you understand it. I will also tell you, and again, this harkens back to my short attention span, I don't think about it very often, not for very long when I do. So.
Well, Linnea, unfortunately, we are over time, but I want to just try to wrap up by asking what message you would give to this research community.
First of all, my message of gratitude. Thank you so much. Know how important what you're doing is. If you have not known somebody yet who has cancer, almost certainly you will. It touches all of our lives, and as I say, doesn't touch your life, knocks you upside the head. And, you know, it's a very tough disease. You know, the more I learn about it, the more I realize there is to know about it. That whole genetic rolling of the dice, it's got a pretty big advantage. But can eradicate a lot of suffering by trying to figure out some better therapies and some better strategies for dealing with this. And frankly, even if we can't come up with a cure for cancer, if we can come up with a way to just extend people's lives, then those people will be so very grateful, and so will their friends and family. So, thank you.
Thank you.